Welcome, everyone, and thank you for joining us for the NADTC webinar on Removing Barriers to Transportation and Expanding Senior Mobility webinar. We're glad that you were able to join us today. A few logistics before I turn the session over to your presenter. The webinar is being recorded today, and the recording will be available on the NADTC webinar within a few days after the session, as soon as we can get that up there. If you are connected by phone and by internet, please go ahead and mute your computer speakers. You will experience some feedback if you aren't already without taking that step. And then if you're having any trouble connecting with Blackboard or onto the webinar platform, if you're still trying to do that and you're hearing this on the phone, then you have two options. You can either contact Blackboard Technical Assistance at 877-382-2293, or you can email me, Christy McLaughlin, at mclaughlin@gmail.com. I was the one that sent out the connection information, so you should be able to just find that and reply to that email with the details of the issues that you're having, and I will do my best to get you connected. Just a reminder, though, that you do not have to join the webinar room to participate. You can participate just via phone and by following along with the PowerPoint presentation that was emailed. You don't lose any functionality doing this. You can still email questions, and we'll give instructions on that in just a bit. To ask a question, which you can do throughout the session, and we'll also have a question and answer period at the end, but you can ask a question or make a comment by typing into the chat box if you're in the webinar room, which is to the left of your screen, the left and the bottom, or you can email your question to mgray@n4a.org, and that's mgray@n4a.org. And also finally, captioning is being provided for this webinar. Thank you to Becky for joining us today and doing the captioning. To access that, you can either press Control and F8 on your keyboard, or you can click on the CC icon, which is at the top left of your screen. A separate screen will pop up that you can customize to your liking for size and font, and you'll be able to follow along that way. Without any further ado, I am happy to turn the session over to get us started to Virginia Dyes. Virginia is the co-director of the National Aging and Disability Transportation Center. Virginia?
Thank you, Christy. Good afternoon, everyone. Welcome to the webinar on removing barriers to transportation and expanding senior mobility. I wanted to begin by giving you an overview of the way this webinar is going to go. I'm going to provide brief remarks and then turn it over to Catherine Siha, who is with Senior Transportation Connection. And she will be followed by Laura Kitros, who's with Berkshire Regional Planning Commission. And then hopefully we're going to have some time for questions and answers and discussion. Next slide. So to begin, I assume a lot of people on the phone have seen this slide or a similar slide that talked about the National Aging and Disability Transportation Center. But in case anyone who's on the phone is not familiar with us, we are a partnership between Easter Seals and the National Association of Area Agencies on Aging. So I am a co-director here at N4A, and Carol Wright-Kenderdine is the co-director at Easter Seals. We're funded by the Federal Transit Administration within the Department of Transportation, and we also receive guidance from the U.S. Department of Health and Human Services Administration for Community Living. Our focus as a center, our mission is to promote the availability and accessibility of transportation options, particularly for older adults and people with disabilities, and doing that by working with communities nationwide. We do a number of technical assistance functions. We do information and referral assistance. We have a toll-free number, and that's listed on my final slide, and an email address where you can send inquiries. We have a website. We do a lot of social media interactivity, and we also do an e-newsletter. So if you're not receiving our NADTC e-newsletter that comes out at least once a month and sometimes multiple times in a month, please go to our website, which is www.nadtc.org, and sign up to receive it. Next slide. So today we're going to be talking about a grant program that the National Aging and Disability Transportation Center supported in 2017. These were 12-month grants that were funded at a total of $300,000, and each grantee could be funded up to $50,000 for the year. The purpose of those grants was to strengthen connections between transit and human services organizations, to build bridges in the community between transportation and programs that support community living for older adults and people with disabilities. And those organizations include area agencies on aging, centers for independent living, community action agencies, any number of organizations in the community that serve those populations, including faith-based organizations. And to identify strategy for better using federal, state, and local funding opportunities. And we at the NADTC are particularly focused on the Section 5310 program, which is available through the Federal Transit Administration and is administered usually at the state level by your Department of Transportation or by another designated organization in the state. And those funds are intended to enhance transportation for older adults and people with disabilities. It's a great opportunity, and if you're not familiar with that program, there's lots of information on the FTA.gov website about the Section 5310 program. Next slide. So we funded 6 grants. And I'm going to give you a brief overview, and then we'll turn it over to our 2 speakers who are representative of 2 of these grant programs. One of our programs was Area Agency on Aging 1B in Southfield, Michigan, and their focus was on creating a model for travel training that would work in their community. I'm going to skip Berkshire and go on to the city of Hernando in Hernando, Mississippi. They were looking at developing new travel options to connect hard-to-reach populations to such destinations as ways to get better nutrition, as well as other hard-to-reach destinations in their community. A 4th grantee was Mountain Empire Older Citizens in Big Stone Gap, Virginia, and they were looking at making improvements in the transportation that they provide to persons with chronic care needs, including people receiving dialysis. And Peace Village Cancer Institute Network in Cincinnati, Ohio, developed a transportation navigator program that was tied to an already existing cancer navigator program, so that people who came to them for help as they were experiencing a diagnosis of cancer or getting cancer or getting treatment for cancer would also be able to access transportation as they needed. Again, I'm going to skip Senior Transportation Connection because I don't want to steal the thunder of our 2 excellent speakers. Next slide. So this is my next to final slide. And I wanted to talk about what we learned, some of the lessons that we learned through the entire grant program, which went on for 12 months. One is that time and flexibility are key. Unfortunately, I think when we give a lot of community grants, they are very constrained in terms of the amount of time that they have to complete their work, and that was certainly true with our 2017 grants, as well as constrained by the amount of funding that they have. So within those parameters, it's really important to understand that as much flexibility, as much responsiveness to what's going on within the community is really, really critically important. It's also very important, and I think these grantees that are going to speak this afternoon would reiterate this, that it's really important to be able to know where you're going right from the beginning and be able to talk about that to people in your community. It's not only a way to do outreach and sell your project, but it's also an important way to keep you focused, to keep your eyes on the prize, and to ensure that everyone who works with you understands exactly what you're trying to do. Partnerships are critical to success, or partnership is critical to success, whatever grammatical error was made in that line. But it is critically important to recognize that no one organization owns all of this space, that it's really important to reach out to others, to other organizations, to stakeholders, to older adults and people with disabilities and family caregivers themselves, to engage them in your process. It's also very important to match whatever you're planning to the actual needs and preferences of the target group. And I can't emphasize enough the value of talking directly with people who use the service, or even people who would like to use the service but have not gotten comfortable using it, to find out what their concerns and issues are, as well as how they prefer to be served. And while you can't respond positively to every suggestion, it is really important to gear your innovation, your great idea, to what's actually needed and wanted in your community. And finally, sustainability. Sustainability is something that we emphasize in all of the grant programs that we have supported over the years through the NADTC and previously through the National Center on Senior Transportation. And while sustainability in many people's minds equals having funding to continue the work, and I can't deny that that's certainly true, it's also important to recognize that that isn't the only way to sustain a program, that there are ways to build support within your organization, among your partners, to build support within the community for the work that you have undertaken, so that even if the money to sustain it and to continue it is not immediately forthcoming, or is really insufficient to continue the level of service that you have begun, having champions in the community, having others who will speak about the great value of the program can really help to keep the momentum going. And final slide, my final slide, is my contact information, as well as contact information for the center. So with that, I'm going to turn it over to Catherine.
Thanks, Virginia. So I'm going to talk a little bit about Senior Transportation Connections experience under the grant program and what we were able to accomplish. We chose to pilot an evening and weekend accessible transportation service within Cuyahoga County, which is the greater Cleveland area, not only for older adults but also individuals with disabilities. It was based upon an existing program with 13 years of history, partnership, and reputation in this community. We leveraged existing partnerships. But for us, the innovation was creating not only an evening and weekend off-hours service that met a significant gap in the community. We were able to offer more destination choices and pilot our first consumer-directed or private pay program. In keeping with the grant, our aim was to develop something that was sustainable, as well as an innovation in terms of the gap in our community's services. So the existing program that we were building upon is a daytime program. Last year was our most active year ever in our 13-year history. We delivered 128,000 trips during a weekday service. We had more than 5,000 active clients. We covered more than 1 million miles across the county. We have about 30 partners, mostly municipalities, as well as some social service agencies, the local area agency on aging, and some other service providers that work with senior adults. We're predominantly drivers on our staff, and our budget last year was $4 million. Our existing model is where communities or social service agencies contract with us for a daytime service in a true public-private partnership. It's the way we were founded and established, and we offer efficiency, affordability, and a specialty and expertise in transportation that is accessible and meets the needs of individuals who have mobility concerns. While it's very affordable for a passenger who pays very little or perhaps is asked to make a donation, the city picks up most of the cost of our service, typically the locations are highly restricted in terms of how many rides per week an individual can take. Medical appointments are prioritized because obviously that is a big concern, especially for older adults who have chronic diseases or health concerns to manage. Shopping trips and senior center functions are also common destinations, but between the destination limitations, community and agency budgets, and a weekday-only service, there is a gap. And for us, we were looking to provide additional independence and autonomy, more access to social, recreation, or perhaps worship opportunities, to give people the autonomy that comes with a private pay service, and really give them self-direction and different choices at a time where we have determined there were even fewer opportunities to get accessible transportation. We're leveraging a known, trusted brand in the community. We've been working very hard to keep up on expanding our fleet with accessible vehicles that are attractive, they're comfortable, they're driven by a trained driver who understands how to work with individuals who may need assistance because of their mobility limitations. We were also hoping to expand and reach more younger adults under age 60 who may have interest in our service. We had 3 great partners. Services for Independent Living is a local advocacy and support organization in the region with a lot of experience in working with adults with disabilities of all ages. They also managed their own transportation service during weekdays, so they were extremely helpful in terms of researching pricing, how the model should operate, strengths and weaknesses and limitations and challenges that we might face during implementation. Our pilot partner was the City of North Olmsted, a longstanding partner in the area. I'll talk a little bit more about what they brought to the project in a moment. And then the agency planning, NOACA, Northeast Ohio Area-Wide Coordinating Agency, is the local planning entity, and they are the administrator of 5310 funds in this region. And they often have advised STC with research, planning, and assistance in promotion. We launched the project in North Olmsted, which is a small community in suburban Cleveland on the west side. Not only did they have a great working relationship with us and a long history with us as a partner, they also had some great demographics that we felt made them a good partner for launching this project. A significant senior plus population, working age adults with disabilities who don't drive. Already about 500 residents use our daytime program for shopping, medical appointments, and senior center activities. And the senior center itself is extremely popular, excellent programming, very vibrant, good communications, and really a strong linkage to the seniors in the community. So they really helped us with working on a basic model and implementing the program and testing it on a small scale. They also helped us in terms of accessing seniors to get feedback on pricing, destinations, how to enroll and sign up for a ride, differentiating this product from our core weekday service, and just some other issues that we felt were important to explore before the actual launch. We purposefully developed a program that we feel has the best chances for sustainability because it is fee for service. It gives the client more autonomy in directing where we take them and in dictating what service they receive from us, but it is a private pay model. We came up with pricing after research that is based on a per trip cost plus per mileage charges. We really promoted and had some success in encouraging people to put together group outings. We also have explored partnership with local businesses or churches that may want to sponsor and pay for the service for their constituents. And we also have determined and really worked with a demand for dialysis. Even though we were envisioning something more social in nature, medical care is important, and we have connected with a number of people in the community who really need transportation on weekends to maintain their dialysis services. The grant enabled us to develop and implement a robust marketing plan across all media channels, both traditional, old-fashioned print media, as well as social platforms and electronic communications. The challenges probably are not surprising to anybody who has experience with transportation. Communicating a value proposition became extremely important very early in the process, especially in terms of working with people who are accustomed to their community paying for the bulk of the trip, and now under this new set of circumstances on evening and weekends, finding out what the true cost of affordable, accessible vehicle with a trained driver, safe conditions, at your demand, communicating what the real cost of that is, and ensuring that our pricing reflected something that we could, there was a value to the client, but yet it was still affordable, but yet we cover our costs, and it is a worthwhile venture for us to continue to pursue. Marketing, as we all know, is costly, and it's something that you have to do and invest in consistently and with good themes, and spend the money really to promote the product to the public. Building volume. Some feedback we got from other grantees, as well as Virginia and the other experts and at NADTC, was the clear message that we have to be patient. Programs like this take time to build. The volume will take time to build, and we have to be invested for the long haul, long beyond the grant period, and commit to that, and commit consistently. And we understand that challenge, and we continue to be committed to this. We really need to make clear that the daytime service is separate from the evening and weekend service. In ways they're similar, but there are differentiators, as I've covered in this presentation. And we're always concerned that staffing, having drivers available on the weekend, especially when they put in a busy work week. But we've been fortunate. Our drivers enjoy the evening and weekend opportunities. They feel that it offers them an opportunity to provide a very customized level of personal service and customer service. And so we've been fortunate that it hasn't been an issue, but we don't take that for granted. Under the grant, we started delivering rides April 1st of 2017. So we had 9 months of service delivery that was subsidized and supported by the grant. We achieved a little bit more than 500 trips. What did surprise us that the users were frequent repeat users. In other words, we had a lot of people try us and try a trip that we were able to provide the first trip free, funded by the grant. But people who came back frequently. And we really had 28 repeat users who continued to use us steadily after using the free promotional ride. Then they came back and continued to use us frequently throughout the grant period and beyond, paying out of pocket for the service. We continue to focus on marketing and advertising afterwards. And post-grant period, we're still averaging about 80 to 100 trips a month. We are seeing some revenue continuing from the grant. And also, at the beginning of the year, we received a planning grant from the Cleveland Foundation, which is allowing us to continue to explore and understand better how to grow this program, set realistic benchmarks, come up with some new marketing ideas, and just really keep moving towards the promise that we saw in the initial funding and partnership with NADTC. Here's my contact information and how to find more about Senior Transportation Connection on our website and social media. And I look forward to your questions after Laura completes her discussion.
Thanks, Catherine. I'm Laura Kitross. Hi to everybody. I am the manager for the Public Health Program at the Berkshire Regional Planning Commission. And I'm going to talk about our Berkshire Ride to Wellness program that was funded through the NADTC grant. So, where's my, hang on. So for those of you who aren't familiar with Berkshire County, we are in the far western side of Massachusetts. We are surrounded by 3 other states. We're bordered by New York on our west, Vermont in the north, and Connecticut on the south. Only our eastern border, which tends to be very sparsely populated, is contiguous with the rest of Massachusetts. And there is a certain amount of geographic and cultural separation from the rest of the state. Berkshire County is a fairly large state for New England. I don't know about in the West, but here in New England, it's a fairly large county. It's 950 square miles with few major roads. There's really only a couple of north-south roads, and then the Mass Pike comes through the southern half of the county. The winters are fairly long, and it can really take 2 hours to drive. If you were going to drive from one end to the other end of Berkshire County, it can easily take 2 hours. There's about 128,000 people in the 32 municipalities in Berkshire County. Most of those towns are very, very small. We are a rural county in a somewhat urban state. More than half of our municipalities are under 2,000 people, and most of the rest are well under 10,000 people. We have only 2 municipalities that are over 10,000 people, one of which is 13,000. For those who are not familiar with Massachusetts, we have no county government or infrastructure. Everything is done on a town-by-town basis. And this makes things like dealing with transportation challenges that much more challenging, because if you've got a small town of 1,200 people, they're expected to provide all services to their residents without any county government or county infrastructure. So that just makes everything a little bit more challenging. I already talked about where we're located. Overall, the county has the lowest median income in Massachusetts, about $20,000 lower than the state median. Our economy is very much based on a tourist economy, a service economy. We are the 2nd oldest county in the state after Cape Cod, and Massachusetts is not a young state for those of you who are familiar with it. We're aging quite a bit faster than the state and the rest of the country. And many of our municipalities, this is not only because our older adult population is growing, but it's also because, like many rural counties around the country, we are losing our 20 to 40-year-old population, which then in turn means we don't have many young children. So it is an older population. Our estimates are that close to 25% of the population will be greater than 65 by 2030, and more than 50% will be over 50. And then the smaller, the more isolated the towns are, the higher these numbers are, the more likely they are to have a larger, older adult population. And not surprisingly, public transportation is extremely limited. So these were kind of the transportation issues or the challenges that we were looking at when we were trying to come up with some ideas about how to improve transportation options, particularly for our older adults and for people with disabilities. So our project goals were to provide transportation to prearranged medical visits for older adults and those with disabilities without other transportation options. So councils on aging, there's one per town, again, following that model of everything being done on a municipal level. And other transportation providers who are willing to cross those traditional jurisdictional municipal boundaries to provide rides under the program were reimbursed for those rides. So if they were willing to go get somebody from a neighboring town and bring them to their medical appointment under the grant, we were able to reimburse them. We had a centralized number that was called. This was our area agency on aging, the Elder Services of Berkshire County, so that people weren't in the position of having to call. They didn't have to know which Council of Aging might be willing to serve their town. They didn't have to call, find the right person. They didn't have to then be told, no, we can't accommodate you, call this number. Instead, we had people call this one line, and then Elder Services made all those phone calls to make sure, to find out if they could be accommodated by the participating providers. And then the transportation providers entered the information on the rides into an online system, which helped facilitate reimbursement. It took us a little while to get that up and running, but once we did, it was really helpful because then we were just able to download what rides had been provided, and we didn't have to depend on them to report those rides, and the Councils on Aging didn't have to depend on their drivers to remember later. So as of 2017, prior to the grant, this is what the transportation situation looked like in Berkshire County. 9 of our communities had Council on Aging vans. This is through the federal 5310 program through our local transit authority that these vans are purchased. They're purchased through the 5310 funds, and then the municipality is responsible for paying a driver or finding volunteer drivers, paying for maintenance, paying for upkeep, paying for gas, and so on. So the towns in green had Council on Aging vans. 2 additional municipalities had a volunteer driver in a van or a car that had been donated to the municipality. Those are the ones in blue striped. Both of those have since gone out of service, but they did exist at the time. 6 additional towns, the red striped towns in the southern part of the county, had already regionalized and were working on a regional basis with a van through the Southern Berkshire Elderly Transport. They had a van that had been purchased through Section 5310. They were hosted in Great Barrington, which is the larger town there. Has a population of about 8,000, which in that part of the county makes it a larger town. And the towns paid into that, and then there was also an additional fee for any rider. 13 of our 32 municipalities had no senior transportation option available at all at the time. So we went out and we sold this program, or tried to sell this program, and we said, you know, if you've got a van and you're willing to provide transportation to other towns, this is what we can reimburse you. And we tried to make it not just covering their costs, but also giving them an incentive above that. It was a small incentive, but it was enough of an incentive above that so that they could justify that the van was not only serving their own residents. Ultimately, 5 of the communities that had Council on Aging vans signed contracts with us to provide services under the grant, and 4 of those 5 provided rides under the program. The 4 provided, all of them provided a reasonable number of rides, but there were only 5 in the end who were able to do it. So our results were, we didn't get started until July 1st. The grant ran from January 1st through December 31st. We had really hoped to be up and running several months earlier, but there were a lot of complications. Again, when things are done town by town, every town needs a visit, and every town does things a little bit differently. Every town paid their drivers a little bit differently. Every town had different hours that they ran. So it took us a reasonable amount of time to get it up and running. So we only had 6 months of service. It was publicized fairly heavily. We did some direct mail. We did ads in the newspaper. We had lots of flyers in the Councils on Aging, both in receiving towns and in the towns that were providing services, flyers at medical offices, and so on. It was billed as a pilot program. We didn't want people to think this was a permanent thing. On the other hand, as I'm going to discuss in a minute, as a pilot program, it had some drawbacks. People are very reluctant to change their habits for a pilot program. In the end, over the 6 months, we had less than 100 calls that were received by the centralized call line. We had expected far more than that, so we were a little surprised by by the low numbers, but still we had 100 calls over 6 months. And about 86% of those were accommodated, which was actually much higher than we expected. So we came very close to meeting numbers. However, we had fewer calls, but we were able to accommodate a far higher number. People did come back, like Catherine said. Once they tried the service and liked it, they tended to come back over and over again. So we had fewer unduplicated individuals than we expected. The trips were also quite a bit shorter than we expected. We expected people to have to travel long distances, and that would be the trips that they had the most trouble getting other transportation for. But what we found was that people really were only going 1 or 2 towns over. You know, they were starting in one town and they were going 1 town south to get to see their doctor or to get services. However, there were a few really kind of life-changing trips that we were able to arrange outside the Councils on Aging. Notably, we were able to arrange several trips to Boston for specialty visits, most notably where we were able to take a woman who was looking at a lung transplant, and it was really very exciting to be able to provide that because there was really no other way that she could have gotten there. So looking at our results, despite the numbers being lower than we expected, we still know the need is there. We've done a number of public forums over the years. That's where this program came from, both from our Transit Authority and our Councils on Aging telling us that this was a need, and then also through our own public forums that we have done over the years. People are constantly telling us that they need transportation, that transportation is an issue. So, you know, it kind of got us, after the grant was over, we went back and did a fairly thorough analysis of why were the numbers lower than we expected them to be. And some of the things we were told were that actually, even though everybody worries about getting to medical visits, and even though that's what you hear in a public forum, the truth is that many individuals are able to ask for a ride to a medical visit from a friend or family, and they're more inclined to ask for that kind of ride from a friend or a family member or through another social service program or provider than they are to ask for transportation to social and cultural events or shopping. So while everyone's concern is being able to get to those medical visits, the real need, as the Cleveland group found, is that people can't get to social and cultural events, they can't get to shopping, they can't get to exercise, and so on. The other thing we really heard was that many individuals are very reluctant to change their patterns for a limited pilot program. No matter how good that program is, if they've got something in place that's working, even if it's working really imperfectly and they have to cancel appointments and it's not working all the time, they'd rather stick with that than try something new that's just going to go away. We also had a lot of limitations on the geographic reach. At least 7 of the municipalities that had no transportation before the grant program could not be accommodated during the grant program either. It had to be geographically feasible for those towns that had the vans, and they just couldn't go long distances. I'm going to go back and show you again. Here you can see in green, those are the towns that have the vans, or in the red stripes. And it just wasn't possible for some of these providers to get to some of these towns over on the eastern border, for instance. And then several of our larger councils on aging were simply unable to participate due to capacity issues. So the city of Pittsfield, which has several vans because they run a very active adult day program, they simply couldn't commit. The town of Williamstown, we had the same issue. So towns or municipalities that we had talked to ahead of time who were very enthusiastic about the program, when they actually looked at their numbers, they realized they simply did not have the capacity to be going to other municipalities and crossing those jurisdictional boundaries. So we did have some successes, though. Again, in Massachusetts, where everybody's used to home rule and doing everything on their own, just simply getting municipalities to share services across municipal borders is a huge accomplishment in and of itself, and making them realize that that is possible and that worked. We got a lot of positive feedback on the program. Everybody was enthusiastic about it. We did evaluations with each of the riders. Very enthusiastic. They loved the program. The people who used it absolutely loved it. And the Councils on Aging staff, including the drivers who were initially a little bit reluctant, were all also quite enthusiastic. Our drivers were the least enthusiastic, especially when they were volunteer drivers. However, everybody who participated in the program had mostly positive things to say about it. Also opened up a conversation about what do we really need. I mean, Virginia talked about that in her introduction. Although we had done public forums and we thought we knew what people needed, this really continued that conversation and made people think very carefully about what they actually needed. So we realized we need more vans with four-wheel drive. In the winter, to get up into the hill towns or to get up to people who are more isolated in rural areas, you really need that four-wheel drive. We need more vehicles without the handicap accessibility. Some people simply don't drive. They either don't have a car or they're no longer able to drive, but they don't necessarily need the full functionality of the larger handicapped accessible van. So cars or smaller vehicles that are more versatile are also needed, as well as the vans that have the handicapped accessibility. And we did form some permanent cross-jurisdictional relationships that are either in the process of forming or have already formed, which was really the ultimate goal. That's what we were looking for. So in the green, you see Dalton and Hinsdale. That was a very successful relationship under the grant. I think they saw that although the need for certain individuals was large, it wasn't that many people, and it was something that the municipalities could actually fund themselves. And that relationship is continuing. The three in red, I believe there's actually another town. They're in the process of talking. The town of Adams has a couple of vans. Cheshire has one that runs very part-time. They're all talking about how they can work together and continue the success of crossing jurisdictions. And then in Richmond and Stockbridge, although Richmond was the town that did not provide any rides despite having a contract, they have agreed to change their policy, and their neighboring town of West Stockbridge, which they already share some services with, that's now a permanent change between those two towns where their volunteer drivers are willing to pick up people in West Stockbridge. So that is my contact information. Please feel free to reach out to me if you have any questions that don't get asked in this webinar. And I also look forward to the questions, and I'll turn this back to Christy to open it up for questions.
All right, thank you so much. Great presentations. I expect that we'll get some really great questions as well. Just to remind you, there are two ways that you can ask questions. You can either type your question into the chat box, which is on the bottom left of your screen if you're in the webinar room, or you can email your questions to mgray@n4a.org. That's mgray@n4a.org. We did have a question, Laura, in the chat box while you were speaking. Somebody did want some clarification. I'll go ahead and present this to you as to whether you were providing central pickup locations or providing door-to-door service.
No, given the population, we were doing door-to-door service. These were older adults, people with disabilities, often both. And that is typically the Council on Aging vans as well. So they did go and pick them up at their address, take them to the appointment, and then pick them up again at the doctor's office and take them back to their home.
Okay, great. Thank you so much. We do have a couple of other questions. Melissa, I'm going to check with you, though, to see if you've received any email questions before I go on.
I'm seeing while Melissa's looking that somebody also asked curb to curb or threshold to threshold, okay. Which is very similar to that question. In general, the drivers will take people to their door. It's not always, quote, as advertised, but the drivers tend to be retired people themselves that's picking this up as a part-time thing, and they're going to help people get into their house. So in general, it is threshold.
Okay, great. All right. Well, Melissa, if you get questions via email, just pop in and let me know. We can take those as well, but I'll just keep going with the questions in the chat box. So the next question, do you have information on how to write a grant for a volunteer driving program for a medical appointment or for a rural county in Oregon? So would either of you have any resources that you particularly like with regard to the best way to write a grant for that type of program?
This is Catherine, and even though I don't work in a rural area, I would suggest that if there's a foundation center affiliated library nearby, contacting that entity, because they often are best at helping you find the right resources for writing a grant for any purpose, and they have a good dispersal throughout the country and should be able to point you in the direction of how best to describe your local situation to win funding.
Yeah, and I would agree with that, and I would also just, again, suggest talking to your partners and other transportation providers in your county to make sure this was an idea originally that came from our regional transit authority. So just talking to them and talking about what programs they already have and what they've tried in the past, and making sure that what you're applying for is something a little bit different.
Okay, great.
Christy, this is Virginia.
Yes.
I have a response to this question.
Great.
A couple of things. One is, if you are interested in pursuing funding through the 5310 program, it's really important to become part of the local planning. The Human Service Transit Plan that gets developed locally, if you're not aware of who's involved in that, reach out to your transit provider, reach out to your State Department of Transportation, find out how that plan is developed, and really become a part of it, because all of the funded projects through the 5310 program emerge from that planning process that is done locally. And the other thing I would say is some of the guidance that we include in the request for proposals that we do under the NADTC, to really know that what you're proposing is something that fills a gap or a need in your community, and being able to talk about all the other resources that are available and how the program that you're thinking about developing will fit into that picture and will fill a need for people who live in your community. So those are just a couple of things, but feel free to look at our RFPs online at the National Aging and Disability Transportation Center.
Great. Thank you, Virginia. So the next question is, how was eligibility determined for both of your programs? Whoever wants to go first.
This is Catherine. Ours was really extremely simple. It's just, are you 60 and over? Do you living in our service area? Or are you in need of accessible transportation because of a physical limitation? And we have to abide by those two rules simply because there are restrictions on we have to be not competing with conventional taxi cabs. There's some legal restrictions. So as long as one individual within the party met that requirement, we could accept the ride.
And ours were very similar. It was very simple. And, we took people's word for it. We didn't ask for ID to prove they were 60 instead of 59. If they were an older adult, if they had a disability. We also defined medical visit as broadly as we could. A dental visit counted, a physical therapy visit counted. At least one person went to a doctor's appointment, and then the driver took them to fill the prescription at Rite Aid, because we felt like that still fell within the spirit of what we were trying to do. I was asked at one point, I don't think anybody used it for this, but I was asked at one point if a smoking cessation appointment would count, and I said absolutely. Again, I don't think that actually happened, but for the most part, we didn't do any kind of screening. People said they were over a certain age. They said they had a mobility issue, and we took their word for it.
Okay, great. The next two questions are going to be general NADTC questions. So the first one is, will the NADTC provide a presentation from each of the other 4 grant recipients?
We have a summary that we have been working on for a while about all of the grantees that we will soon be putting on our website. We have talked about doing additional webinars that will present the work of the other grantees. We've done a couple of workshops at different conferences that have featured others of the grantees. So we are considering hosting some additional webinars, but probably not at this point until early 2019. We right now, just to make you all aware, we've just started a new grant program. We haven't done a public announcement at this point, but we expect to be doing one probably next week. And these are planning grants, so that generates an intensive flurry of activity. But we do still have, as part of our plans going forward, to hold some additional webinars.
Great. And then also grant-related is the next question. What is the deadline for applying for these grants each year?
Well, it isn't. We have not been able to do a grant every year. And we do have some constraints in terms of the timing of grants and the type of grants based on our cycles of funding that come to the NADTC. However, we just completed a grant cycle, and we have grants that are just beginning their work in the month of August, and will continue their work into the new year. And sometime in the fall, probably late fall, we are likely to do another grant announcement. We are still not certain of our year 4 funding level, so all of that remains up in the air. But this would be the first time that we have been able to do 2 grant cycles very close together that are meant to be complementary of one another. So I suggest you stay tuned for that. Also, to be sure to check the FTA website, the NADTC website, because we do try to identify other grant opportunities. I know that the National Center for Mobility Management has done some grant making recently, and that FTA is in the process of selecting grantees from an application that they issued earlier this year. So keep your eyes and ears peeled, and the best thing to do to find out about it is to sign up for our NADTC e-news.
All right, great. Thank you, Virginia. The next question is for Laura. How is collaboration between such a diverse region implemented and maintained?
if you find the answer after that, you know. It's difficult. We do have a large area to cover. There are a lot of partnerships that already exist. We were already working with a lot of those towns. I do work for a regional agency. I work for the Regional Planning Commission here, and I also work for, oversee a Berkshire County Boards of Health Association, which is a professional organization for the local boards of health. So you're already working with a lot of the partners. You already know a lot of the municipal players. And it's just, building those relationships in the off years when you don't have a particular program or a particular grant that you're working on. And then they come to you and say, we've got this great idea. Or you can go to them and say, I've got this great idea. Let's apply for this grant together. But it was definitely difficult, and it took a lot of individual work. And like I said in the beginning, when we were trying to set up the project, I thought, I'm just going to write a template and send out the contract to everybody, and they'll all send it back to me the next week. And instead, each one was an individual negotiation just because every town did something different and did it in a different way, and a different person had to be consulted and so on. So it's certainly hard to work over a larger area, especially one that's used to being self-governing in small entities. But it's possible, and you know, I just always recommend building those relationships before you need them.
Great, thank you so much. Our next question is a clarification question on door-to-door. The question is door-to-door service mean going into the building and then back to their door?
Okay, so for the most part, because we're a rural area, we're talking about single-family houses or at most, you know, a duplex or so on. Some of the senior housing is multi-apartments. I assume that it means just going to the door of the house in most cases. I wasn't there. I can't say exactly what a driver did in any given situation. But no, in most cases, it would just be going to the door of the house.
Okay, so not actually through into the building.
Yeah, but again, I can't guarantee if somebody didn't have anyone there to meet them and that the driver saw that and wasn't rushing back to pick somebody else up, I would not doubt that they went in and helped them get inside. But overall, the policy was certainly only to get them to their door.
Okay, great.
And this is Virginia, and usually there's another designation called door through door, and there's a distinction between dropping someone at their door and actually accompanying them inside the house or making sure that there's somebody there to help them access their home safely. And the same is true for at the destination, to actually go into the building where they're going, to a doctor's office, whatever. That's typically called door through door, whereas door to door implies that you will get them to the door and maybe open the door, but won't accompany them at the appointment or in their home.
Okay, great, thanks. The next question, and this is, I'm assuming for both of you ladies, were there many consumers with vision loss receiving transportation for your programs?
I know that one of our clients indeed had vision impairment, and we do track our overall population of users. And we also make sure that our drivers are trained to work with, provide proper sighted guide techniques, and also deal with other conditions that are common amongst older adults, like dementia, as well as physical disabilities.
And we did not track what their specific disabilities are, so I don't know. I do know, so again, being in New England and being in a more rural area, people do not give up driving easily here. People drive far longer than they might in other areas, and vision loss is certainly a common reason why people realize they really can't drive anymore. So I would suspect that we had people with vision loss, but we did not track it.
Okay, thank you. The next question, I think either of you two ladies may have some input on this, and Virginia, you may know of something as well. But is there an online schedule template for volunteer drivers that you know of?
So we used a form that they access through our website, or not through a website. I'm happy to provide that, but it was a very simple, you know, it was essentially an Excel spreadsheet that we turned into a form through the website. They clicked on that. They got a password. They were able to fill in, you know, what was your starting destination, what was the pickup address, what was the destination address, what was the drop-off address, end address, number of miles driven, the hourly rate of the driver, plus the incentive, and, you know, a total. And some of that added automatically for them. It was pretty simple.
We have a database that we use, and our drivers are paid. So we were fortunate that we had infrastructure to track all the data that Laura also described for her program.
This is Virginia. There is actually a volunteer management database that many volunteer transportation programs use. Unfortunately, I'm blocking the name of it, but I will ensure that we provide that information, and that when we post the slides, that we will provide that information as well on our website.
Okay, great. Thank you. Next question is, let's see here, is for Laura. Do people have a central number for the program to call for a ride, or is it their own city?
No, one of the things we were very clear about that we wanted to do is make sure there was a central number, because that can be one of the most frustrating things about living in a rural community with small towns where nobody's home half the time. So we really didn't want the clients to have to call around and find their own ride. We really wanted there to be a central number they could call, and then all the business of trying to find them a ride was done behind the scenes, and then they were called back and said, yes, we can accommodate that, or no, we can't accommodate that. And if the answer was yes, this is the town that will be providing the ride and who will be picking you up. So that was one of our main things that we wanted to make sure, is that people weren't calling a part-time council on aging or trying to figure out who they needed to call. And if that person couldn't do it, who they needed to call next. We really wanted to avoid that. I think the central number is key. I think it's very important for a program like this.
Perfect. All right, next question. The question is it difficult to find and keep volunteers? I assume that the question is indicating, did you find it difficult to find and keep volunteers?
So for the most part, this is Laura, for the most part, any volunteers that were involved in this program were already driving for their Council on Aging. So many of the drivers are paid. So the larger councils on aging tend to pay their drivers. It may be a very part-time job. They may only work a couple of days a week. It's often retired people who are just picking up a little bit of extra money. And they do it because they love it as much as to make the extra money. We did have a couple of towns participate who had volunteers, and those were the drivers we found that were the least enthusiastic about increasing the jurisdiction. They kind of got into it just to help the people in their town. So I think it can be difficult to find volunteers, but it wasn't something we needed to do as part of this program. The councils on aging already had their volunteers.
And our drivers are much like Laura described the paid drivers, part-time. Many of them are retired themselves. So for us, it was just a matter of encouraging drivers to find drivers who are willing to take the extra hours at a different time of day.
Right.
Okay, great. Next question. Did either of your programs assist people with dementia?
Yes, Cleveland did.
Yeah. Yeah, we do as well. We would take, certainly there were people who are certainly on the milder side, but again, if they were able to make the phone call and ask for the ride, or if somebody made the phone call and asked for the ride on their behalf, we accommodated that. And many of the drivers have some familiarity and training around dealing with people with dementia who are still in the community.
Okay, great. Next question. Do you know what the average cost per trip was or is?
In Cuyahoga County, I know Laura had mentioned that she was surprised that the trips were shorter than anticipated, and we experienced the same thing here. So it depends. The shorter trips obviously had fewer costs. But basically, based on our investment and what we feel our price per mile was, we charged $5 per seat and $2.25 per mile. And that was just the basis of a formula of what was competitive in the area, our costs, and then a small profit to sustain the program over the long haul.
So I was just quickly trying to find, it's been a number of months since the grant ended, and I do not remember. It was less than we expected. We paid mileage plus whatever they were paying their driver, and then we added a $20 incentive fee. I believe it ended up being averaging around $50 per trip, which was less than we expected. We paid the mileage, the cost of the driver, and the $20. I want to say it was around around $50 on average. With a couple of the trips, obviously the trips to Boston were quite a bit more, and then we had a few trips that were maybe only a few miles. But on average, I would say that's about what it cost.
And I think too, Laura, weren't we operating under slightly lower fuel costs a year ago?
Yeah, probably. Though I think we used the federal reimbursement rate.
Okay, great. So the next question, it says, I am aware that many health providers and hospitals are working to develop transportation options for their patients, particularly older and poorer patients. There is some Medicaid and Medicare funding they are tapping into. Can the speakers comment on any efforts to collaborate with the healthcare providers on these types of transportation programs?
This is Catherine. I can go first because this is actually our core business is healthcare appointments. I am aware through our legal counsel that there has been some change that makes it more attractive for healthcare providers to consider this. And so we're hopeful and it's a recent development, so we're hoping that might lead to better partnerships for any transportation provider that serves this population. SCC is not a Medicaid provider. There is a transportation benefit under Medicaid that is in place, and we have not chosen to do that at this point. But that is a big avenue of providing transportation that probably works better for other entities. And Laura may have some thoughts on that in her market. So that's right now.
So we have seen some efforts, so we only have, we used to have a hospital in the northern part of the county, a larger hospital in the central part of the county, and then a very tiny hospital, about 15 beds in the southern part of the county. The one in the north part of the county closed very abruptly, maybe 5 years ago. And that facility has been taken over by Berkshire Medical Center, which is the hospital in Pittsfield. And they have developed some transportation between that North County campus and their main campus in the central part of the county. But it's limited. It's not age restricted or restricted only to people with disabilities, so low income people without their own transportation can use it, which is good, but it is limited in terms of when it runs, who has access to it, how often you're allowed to use it. There are paratransit services through our local regional transportation entity, which is a little bit different than what you're asking about, but that does help people who meet those eligibility requirements and who are in towns that are members of the Regional Transit Authority get to medical visits. But in general, we are not seeing large numbers of providers. We just don't have those kinds of numbers, those kinds of large providers in a underpopulated area like we're in.
And Laura, it seems to me that being in an urban center, there are some hospitals that provide service, but even though we're in an urban center with density and arguably greater need, it's exactly as you've described. Some do it. There are limitations. It's not a coordinated program, and some of it's just first come, first serve. You called, and you were able to get what was provided.
And it's really going to be hospital-based. I think in most cases it doesn't really help you get to see your primary care physician or your kidney doctor or, your pulmonologist, unless they're located at the hospital.
Right. And then in some of the things that you were considering healthcare, more broadly interpreted, also wouldn't be possible that way.
Absolutely.
Okay, great. Next question. Do some clients need a personal care attendant as determined either by the application or by feedback from the drivers?
So certainly sometimes they have someone with them. We did not have any limitations if they had a personal care attendant or a family. More often it was a family member. So often you would see a husband and wife, both elderly, both unable to drive, but they would ride the van together. We did at one point start saying, if there was somebody available at and this was at Virginia's suggestion, if there was somebody at the senior center who was able to go, either the outreach coordinator, somebody who was paid at the senior center, or a volunteer who was able to go and help that person navigate if there are mobility issues or if they had dementia issues or whatever. We didn't see a lot of uptake of that, but again, it was such a short pilot program that may have just been that we didn't work up from it. But we didn't determine if they needed a personal care attendant, nor did the drivers. I think if we had gotten anybody who was regularly riding, who was clearly unable to be on their own, we would have needed to do something, but we didn't end up facing that during the length of the program.
And this is Virginia. I just wanted to point out that one of our grantees, Mountain Empire Older Citizens, used a model of providing a transportation aid. Some of them were paid, some of them were volunteers who rode on their vehicles and provided assistance to individuals with chronic care needs or who were receiving kidney dialysis. So that was all arranged through the call center that they created. They already had a call center in place, but they added an element to it where people with chronic care needs were also connected to the broader social services network within the community. So if you want to know more about the Mountain Empire Older Citizens project, please send me an email. I'll be glad to put you in touch with Mitch Elliott, who was the project director. But they really developed, I think, a very workable, adaptable model that other communities may want to consider.
Great, thank you so much. The next thing in the chat section, there are actually a couple of links that were provided by Greene County. Thank you for providing those. One is a Google-based route finder for when there are multiple stops, which is routexl.com. And the other is ridescheduler.com. I assume that the Greene County is in favor of these two, or they wouldn't have provided them, so please check those out if you'd like to. The next question is, did you transport many therapy animals for your programs?
I don't remember hearing about any, which doesn't mean that we didn't transport them. I assume we would have transported them had that been an issue, but I certainly didn't hear that we did.
Okay.
We didn't have anybody for this program, but in our daytime service, we do have a few clients that do have therapy assistance.
Okay, thank you. The next question is, do you use a specific driver training program?
In Ohio, we have a recommended curriculum in order to qualify our drivers to work with disabled and senior populations. The acronym is called DRIVE, D-R-I-V-E. And then we've customized over the years to add our own things that we've found to be important. And then we also make our drivers maintain certification through CPR and first aid through through the Red Cross. And many of our partners also with expertise, like a couple of the questions mentioned things like dementia and some other health concerns. We've gotten training from our partnerships so that our drivers understand, for instance, how to work with people who are going to dialysis and how to provide proper emergency assistance afterwards if required and things like that.
And for those of you keeping score at home, you know that in Massachusetts we do everything town by town. So the different municipalities will have different training requirements. And as far as I know, there is no standardized training requirement, but I assume the things that Catherine mentioned are the things that they pay attention to as well.
Okay, great. So Melissa entered a question that she got via email, so I'm going to read this. It's in the chat section. It says, we have a rapidly aging population in Santa Cruz, California. Though the metro system is in place as mass transit, point-to-point transport would be a more practical means for many. Would a grant to expand service beyond the paratransit model to non-disabled seniors by perhaps adding non-disabled equipment vans be practical for a community with a regional population of 150,000? Santa Cruz is a high-cost, high-average income, and low-revenue tax-based area. Whew.
Wow.
That may need a little bit more time than just the few minutes we have.
But I'm going to say, just looking at that population, I'm going to say yes, unless it's a very young population. I mean, 150,000 is about 30,000 more people than we've got in our entire county, and certainly the need for that point, people who are, not able to drive themselves or who are having trouble navigating the public transit system, but are not quite disabled enough to need the paratransit or to qualify for the paratransit services. And I think Virginia will jump in and say that this is really a case where you need to find out how the 5310 monies are distributed or applied for in your area.
Well, thank you for that intro, Catherine. Yes, one of the things to keep in mind is that 5310 can be used to supplement and expand services that already exist. And one of the things that communities like yours are already struggling with is the high cost of paratransit services, and how can they provide alternatives to the typical paratransit service, which is a group ride that has to be scheduled in advance, and that a lot of people, unfortunately, find difficult to use in some communities. But to partner with organizations that can provide a ride that may not need the equipment that's available in a vehicle that can accommodate electric wheelchairs, for example. People who are older who often need a helping hand or who use a cane or a walker. They may qualify for the paratransit, but they may also be able to be served in other ways. And so the 5310 program, when it was reauthorized, actually in part replaces what used to be called the New Freedom Program. And the New Freedom Program, which was a wonderful program that unfortunately went away, was really focused on going beyond the services that are available for people with disabilities to provide a more individual-based kind of service that supplements what's already available. Lots of programs out there that are addressing things like first mile, last mile. They're addressing things like people who can be accommodated in a car rather than necessarily having to use a wheelchair van. So it's an idea that I think can be entertained through the 5310 program, so I encourage you to get involved in that planning process. I would, since I'm talking, I would like to add that Melissa Gray also posted another resource on volunteer software, and that is assistedrides.com. It's assisted, rides.com. And that is a program that's used by a lot of volunteer programs around the country.
All right, great. Thank you so much. So the next question, and I'm going to mention the question and the link directly after it, but the next question is the DRIVE curriculum publicly available? And the link that's directly after that, which was provided by Greene County, thank you for that, is a one-page fact sheet about the DRIVE curriculum. So I opened it. I didn't have a chance to read through it while Virginia was answering the last question, but it does look like a good little resource to tell you what's available. It has it separated by resources available for drivers and resources available for trainers, and then there is a contact number at the bottom. So if anybody is interested in that DRIVE curriculum, the link that's directly under that, which is if you're not on the webinar room, just send me a quick email or send Melissa an email and we'll get you that link. But it provides some information and contact for questions. So let's see here. I think that's all for the questions. We did have a comment that says the National Safety Council has listings of driving programs in each state. Thank you for providing that. The link is www.nsc.org. That's a great resource as well. So we have no further questions. So I'm just going to take a quick look here and make sure I'm not missing anything. Oh, here's one more comment. I am a drive trainer. We have to be certified every 3 years to train drivers as of July 1st, 2018, and there's no longer a refresher course. So a little bit of additional information on the requirements of the trainers of the program. Okay, very good. So I'm seeing no further questions. You guys had a ton of them, and they were really great, so thank you so much for that. Unless there are comments from our presenters, then we can close up for the day.
No, just thank you all for so many great questions.
Thank you.
Awesome. Thank you guys so much. So thank you for joining us. We really appreciate your participation in the webinar, which turned out great. I'm thankful to both of the presenters and to Virginia and Melissa for the work that they did to create such a great session. So for that, please take a moment to fill out the evaluation for today's webinar. The information provided is used to improve future webinars, so please take a moment to do that. I'm going to be emailing this link to everyone that will take you directly to the short survey. It should only take you a couple minutes. I'll email that in just a minute so that you'll have that. You don't have to feverishly write anything down right now, but please take a moment to fill that out so that we can get your feedback. But thank you so much for participating in the webinar. Please keep in touch with the National Aging and Disability Transportation Center. If you haven't done so already, I strongly suggest that you sign up for the e-newsletter, which you can do on their website at www.NADTC.org. But thank you so much for everything that you do to increase and improve accessible transportation. We hope that you have a great day.